The cream tends to be better tolerated by men who are metabolically compromised because of the different exposure to the 5-alpha reductase enzyme, which is often suppressed.
And the same thing I think I can see with SSRIs. Like, yes, some people need SSRIs or SNRIs or antidepressants. I have seen testosterone get so many people off of SSRIs or antidepressants or off of diabetes medication. Like, I can completely agree with you. Because of this stigmatization, because providers are so scared of it and people are so scared of it, one of the main things, there's a couple things here. And because it's so stigmatized, again, people are scared of it, they use it as a last resort when it should be the first thing that they use for a lot of things. And I think any kind of metabolic disorder, right? Testosterone should be used first. There's multiple reasons for metabolic disorder, obviously lifestyle, but a major reason is our hormone levels. So if you're obese, if you're overweight and you have low testosterone, it should be the first thing you track. The theory is that if you lose weight, that your hormone levels will increase. We find that to be only true to a very small extent. But you know what else, and what nobody else talks about? Yes, your total testosterone will raise when you fix your lifestyle, when you fix your diet, right? But when we fix our diet, we're also reducing glucose, reducing the insulin response. Your SHBG will shoot up. What I've seen is that people actually, their total testosterone goes up because their SHBG goes up, and your hypothalamus reads the free testosterone. And that's what signals the testosterone level. If your total testosterone goes up and your SHBG up, there's no change in free testosterone. So you're left with the same problem. So in my vast amount of experience, improving your diet, making that lifestyle change to increase your testosterone is a fallacy. It just does not work. We need to get people testosterone to fix their metabolic disorder, also get the dopaminergic effects so that now we are seeing the results from the exercise that we're doing, and we start getting motivated to build something. It's a positive reinforcing cycle that gets people on the path and on the mentality to actually live a healthier, better lifestyle. And the same thing I think I can see with SSRIs. Like, yes, some people need SSRIs or SNRIs or antidepressants. I have seen testosterone get so many people off of SSRIs or antidepressants or off of diabetes medication. It cures type 2 diabetes. I've seen it get people off of blood pressure medications. I've seen it get people off of cholesterol medications, pain medications, because testosterone is systemically anti-inflammatory. For a lot of these things, and I think that testosterone should be the first thing that we try instead of the last thing, or not at all. And then, of course, when it is finally decided to be used, there's a couple of things. They don't understand the pharmacokinetics, the pharmacodynamics of the routes of administration that they're using. So they use inadequate protocols, and they just don't use enough. They use too lower doses and inadequate protocols that they don't understand the half-lives, and things are wrong. What similar things do you see?
I couldn't agree more. Everything you said is in that little snip was very, very akin with a lot of the things that I've been saying recently. So firstly, your point about how free testosterone is what creates the feedback at the hypothalamus. Mm-hmm. This is why this idea of a testosterone booster that reduces SHBG is just not going to work, because your body's just going to get with the program. The body's smarter than you. Like the body's way smarter than any of us even understand. So that's completely true as well. And my friend Dr. Keith Nichols has been campaigning for a while that testosterone should be the frontline treatment for type 2 diabetes in men. And I know one of the topics that you wanted to talk about today was why I've started to speak about the cream more, and I've favored the cream more recently. And it's because that while testosterone is a fantastic treatment for insulin resistance, it's also insulin resistance that contributes to a lot of the side effects of TRT as well. And what we've found in my practice, in my clinics, as well as other clinics that we've partnered with, is that the cream tends to be better tolerated by men who are metabolically compromised because of the different exposure to the 5-alpha reductase enzyme, which is often suppressed. I think one of the big issues that people have, even if they haven't used things like 5-alpha reductase inhibitors, is because of this systemic inflammatory load from being obese and all the consequences of that, they have reduced 5-alpha reductase expression. So I think a lot of the time we're dealing with a 5-alpha reductase deficiency. Increase in prolactin pushes that down more due to chronic stress. And I find that when someone is like severely metabolically compromised, like a dumpster fire, and they jump on the cream, a lot of the time they'll come back with no side effects, everything's great, no bloating, no water retention, no moodiness, no nipple issues, nothing like that, even in the first few months, which I've found to be very remarkable. The other thing as well that I'll also throw in there is that I think that, and I often joke with my wife about this, I don't know anything about women, but I know quite a bit about men. And what I know about men's mental health is that there are absolutely people, like you said, who need to be on SSRIs, SNRIs, antipsychotic medication. Absolutely. They are a much smaller subset of the people who are diagnosed with major depressive disorder than people would believe. And the problem with inflating serotonin, and I think we're potentially going to find out about the cardiac ramifications of that long term, potentially, when they eventually look into it. But the problem with elevating serotonin is that it kind of tricks your brain into thinking that you're doing better than you are in life. And when you mute that discomfort, I mean, if someone's going through a severely traumatic event and the SSRI takes the edge off so that they can take care of themselves and get to therapy and do what they need to do, cool, great. But for people who have kind of gone through life in a unhealthy vessel where their metabolism's screwed up, their endocrine system's not working properly, as a result, they become very low resiliency to stress. They become very avoidant. Their life becomes depressing to live because they become fearful. They become less competent in their realms. So all of these issues kind of stack up against them. And then if you give that guy an SSRI, you're basically just giving his brain a pacifier to go, oh, it's all okay. And I think people know that when they're on these medications, they know that there's something wrong and they feel empty. Whereas when you give someone something that facilitates dopaminergic transmission, it allows the dopamine system to work properly, but it's still mediated by a reward process. You're not just jacking it up for free, you're making that system work the way it should. Then now all of a sudden we're in a situation where we're going, hey, let's make the work feel better, which, you know, gets thrown around a lot for good reason. But now that also, as you said, as an anti-inflammatory, it also buffers and regulates the effects of cortisol and adrenaline. So now we're in a situation where we can actually push outside our comfort zone and take on the world and do these challenging things. And the trajectory of where all these different timelines can end up, kind of like a Marvel multiverse kind of scenario, is massively different. You know, if someone's on a different one of these paths at 30 and it changes at 40, because as you said, this idea, like, you know, if you have a guy who's got optimal testosterone levels and then for like a year or two, he like gets into like, you know, alcohol and junk food and living on the couch, then yeah, maybe dropping some weight, he'll be able to recover his levels because they're working probably 100%. But if someone's been obese like during puberty and during development and that system doesn't function properly, because, you know, juvenile obesity is a new problem. This wasn't a problem decades ago. So if you were obese for decades or for your formative years, or you've never been lean, this idea that if you fix that your testosterone is just going to spike up to an athletic level is just, I mean, that's just asinine. That's just coming from. But also you're in this situation where if that did work, then okay, you'd actually be able to get lean, fit, and healthy. But the problem is because that system doesn't come back online, you can't. It's like pushing shit uphill to get the weight to drop. It's virtually impossible to get people out of these holes. So everything you've said is completely correct. And I'm a big advocate that, and I made a video about this a while ago, is that, you know, I'm not saying that everyone with depression should jump on TRT, but I am saying that if you're going to jump on TRT or an SSRI, like, I know which one's going to be more systemically beneficial, number one, but number two, they say, oh, you know, TRT is for life. You want to be careful with that. You try coming off that SSRI after 10 years and see how that works for you.
Wow, that was really, really well said. And I had never thought about it in terms of the effect of increasing serotonin artificially like that. I had never thought of it from that context. And that is really good, and I'm going to use that. That was a really good take. And I appreciate that a lot.
I'll just give some more context on that so that I can give credit where credit's due, because I totally stole that from Jordan Peterson. But in his 12 Rules for Life book, I'm going to butcher it, but he talks about how lobsters have this serotonergic system. But I won't, you know, give away the whole book. People should listen to it. The audiobook's fantastic. But he basically talks about how when lobsters are territorial, when they fight over, you know, food or a mate or territory, the one who loses doesn't walk around starting fights with the other ones because he's lost. The one who wins the fights walks around and engages the other lobsters. But the problem is that if you give the lobster who loses an SSRI, he goes around and starts fights with all the other lobsters and gets himself killed. And I do wonder if that kind of paradigm can really expand out to a lot of people. And I don't mean to be harsh on people's physical appearances, but a lot of the time the physical appearance is the manifestation of how well you take care of yourself. Is that if we numb the signal when we look in the mirror that we're not proud of what's in front of us, and that can be anything from physical appearance to character to, you know, a whole bunch of things, not just on the outside. I think if we numb that discomfort, it can really do us a disservice because it kind of makes us a little bit delusional and out of touch with reality. And I think we need things to put us further in touch with reality, not take.
You would have no incentive to change, right? To progress, to make changes. Yeah, that's really, really interesting. I really like that. And that would show you why working on the dopaminergic system as opposed to the serotonergic system would be better in that case. Just like we've both said, I've seen so many people, thousands and thousands of people get off of SSRIs because they started testosterone. And just like you're saying too, I think it's delicate. It's a delicate and it's nuanced, but for a lot of people, like they should try testosterone first before the SSRI. Yeah. Very interesting. So moving forward into further like kind of issues that we see with protocols, your use of cream, especially for people who are obese, especially to mitigate some of the estrogenic effects, right? And one of the bigger things that I noticed that novices and amateurs seem to have is they seem to have a lot of questions about estrogen. And estrogen is like one of the main fuels. I've seen you have to forced to do so many videos about estrogen because so many people are so concerned about it and so worried about it. And kind of what I've started to say is, look, if you have somebody who's guiding you that's worth a salt, then estrogen isn't going to be an issue. I know how to deal with estrogen. It's not a problem. Yes, you might get some estrogenic side effects, but I can quickly mitigate those. And I have several tactics with which to do that. So I think one of the problems about people getting so many labs and wanting to see estrogen numbers and being so concerned with estrogen, if you go to TRT forums, it's like one of the main things that's discussed. And I don't think it really needs to be. Again, if you have somebody guiding you who's worth their salt, then estrogen isn't a serious issue. And we can mitigate them. And your use of cream, especially for obese people, is something good. Like, I don't have as much experience with cream from the beginning. I just started to hear a lot of people who indicated that they just had better results, the better absorption from the injections, better results. So I just kind of started going towards cream. Now, with that being said, I've also seen massive benefits from the increased 5-alpha reductase production of DHT using creams. And I tend to use a hybrid for people who have energy issues or libido issues who are on testosterone. And we can also use that to reduce the estrogenic effects as well. So, but what I hadn't thought of, and which I may steal from you, is for people who are really obese to just use cream at first, because, you know, sometimes we're going to be more susceptible to the aromatase, and the injections for some people can be really sensitive to it. Again, I have methodologies to deal with it. A lot of easy first things that we can do is increase injection frequency, reduce the dose, increase injection frequency, find the dose of testosterone that doesn't cause these issues. And then it usually becomes a function of people getting used to the higher hormones levels, right? We've evolved mechanisms to deal with both high and low hormones. But when our hormones are low, we become sensitized to the hormones through several different mechanisms. But we're extra sensitive. And then when we first flood our body with hormones, now that's when we're having some side effects, or that's also where the honeymoon period comes with, when we feel really good in the beginning, because we're really sensitive to these hormones. And what I kind of try to, depending on how bad the side effect is, I kind of try to teach people is, like, for some things, let's just wait. If it's a little bit of water retention, if it's a little bit of nipple sensitivity that's not really causing a problem in their day, that should abate over time. Let's give it a little bit of time.